Hi everyone, welcome to today's video. My name is Dr. Ray, and today I'm going to be entertaining a question on vaccines. And so I've put together a little presentation for you, and this presentation is not about a debate on whether you should vaccinate, whether you should not vaccinate. This is not a pro-vax, anti-vax presentation. It is a presentation to give you some information relating to vaccines so that you can then have that conversation with your veterinarian. And so that's what we're going to be doing today. I've titled this presentation Truth About Vaccines, and we are going to get started. So there is some controversy, due to recent events, et cetera, around vaccines. And so, like I said, this is going to be for informational purposes only. It's not medical advice. I'm not telling you if it's appropriate for your pet or not. And so for that reason, I am going to keep the comments closed because there's not really anything to comment on. If you have a question about if it's appropriate for your pet or not, that's something you should be discussing with your veterinarian. And so we're going to have the comments closed for this particular discussion or presentation. That's kind of the ground rules for today's presentation. So starting out at the top, what are vaccines? Why do we do them? What are they? Vaccines are biologicals. And so that means that they, a lot of times, are real active viruses, bacteria, that have been put into a liquid form. And so a lot of times they're living or they're modified living. And so we consider them biologicals. Their purpose is to train the immune system in a controlled setting. And so in nature, in life, your body will be exposed to a pathogen. It will be exposed to a virus or a bacteria or something that makes them ill. And then the immune system has to come and it has to deal with that in a non-controlled setting. And so you may get a really aggressive strain of something, and it may knock you out for a long time. Your body has never seen it before. It doesn't know what to do. It may do the right things. It may do the wrong things. It may overreact. And so when we use vaccines, what we're doing is we're taking a very predictable approach to training the immune system. We show the immune system a very weak strain of something or a very diluted down version of something. That way, when it's first seeing it, it's not having to go from 0 to 60. We're training it. So just like we start school in kindergarten and we learn the basics, and then we get all the way up to doctoral school, that's kind of what we're doing. We're starting with little baby steps when we give vaccines, and we're allowing the immune system to mature in a very controlled fashion. And what we're trying to do with vaccines is to prevent or lessen the severity of a disease. And so that's a really common misconception that I want you guys to understand. Just because we vaccinate our pets and we vaccinate them for specific conditions, it doesn't mean we're completely eradicating the chance that your pet will ever get the disease. What we're saying is we are priming the immune system to be able to deal with that. And so your pet may still get Bordetella, or your pet may still get whatever you're vaccinating against. It just means that the immune system will be better able to deal with it. Does not guarantee your pet is never going to come into contact with it. Yes, in a sense, preventing, like in the case of rabies, yes, we are preventing it. But in things like Bordetella, your pet may still have symptoms of Bordetella, but they're not going to be as severe or as dangerous as it would have been if they had not received the vaccination. And so why do vets recommend vaccines, stress vaccines, always talking about vaccines? It's because A, we know that they work. Okay, so all these vaccines have been tested. There are inserts and data inside of the vaccine packets. We know that they work. We see it all the time. It breaks our heart when we see a pet come in and have to be euthanized for a condition. Not only because they're so sick that we can't bring them back, but even more that we can't save them because of the financial implications of treating the disease, where we know, a $10, $15 vaccine may have saved this animal's life. And so we know that they work. We've seen it. We've seen when we don't have the vaccines, what happens. We know vaccines are very efficacious. We know they're like 99.9% effective in most cases of preventing disease, are really making them not a big issue. And so because they work and because we know they work, that's why we recommend them. And prevention is more successful than treatment. So it is much easier to give a $15 vaccine for parvo than to perform a $2,000, potentially unrewarding, unsuccessful treatment plan that may still result in the death of the patient at the end. And so we really would rather take the prevention route than the treatment route. Because prevention is key, right? We know that prevention is worth a lot more than working backwards and trying to treat illness. What time does the pet come in? Do they come in at the beginning of the illness? Are they coming in at the very end of the illness where our chances of success are very low? And so prevention obviously is where we want to be. It is more cost effective for you, like I touched base on as well. And so again, that $15 vaccine is way more cost effective than the thousands of dollar treatment plan, where we know a vaccine is 99.9% effective, where a treatment plan, depending on where you enter that treatment plan, you may only have a 5, 6, 7, 8, 9, 10% chance of success rate, depending on, where you enter that curve. And so in veterinary medicine, unfortunately, cost does play a big factor for us. As veterinarians, we are constantly battling the health of the patient, the tools that we have available to us, and also the financial implications. So a lot of times our decisions aren't always being made based on what is best. Sometimes it is what is best in the budget. And so, a lot of times we are recommending vaccines because it's just going to be more cost effective. We know, that you're not going to be able to afford that $2,000 treatment for distemper if your pet, comes down with that. It's also a public health thing. And so rabies, that's the easiest one to explain this to you guys. Rabies is 100% fatal in people, nearly 100% fatal in people. It's a significant public health concern. We cannot, with our oath that we have taken to public health, let that go. Same thing with leptospirosis, very contagious to people. And so there's a number of diseases that we vaccinate, including our large animals and things like that, where these diseases, erysipelas in pigs, they're contagious to people and they pose a significant public health risk. And so we are tasked as stewards of public health to pass that information on to you as well. And so to bust a little myth here, it is not a financial incentive for veterinarians, at least not general practitioners, to do vaccines. Vaccines in veterinary medicine for many, many years, us in the profession, and this is a little bit of veterinary economics, vaccines and annual exams to your general practitioner that has a office, that has a practice, does other things other than just wellness, is called a loss leader. And so we actually lose money and time on vaccines because we try to price them, again, really low and really accessible for those public health reasons, and to establish a rapport with you, to get to know you and to get to know your concerns and you as a patient outside of a sick visit where everything's crazy and we're trying to save a life here. We don't have that dedicated time. And so a lot of us will take the loss on that visit so that we can build that rapport with you and hope that you will continue with us, through the years, and allow us to do some of the other things that we enjoy doing, like doing your pet's dentistry or doing your pet surgical, all the things that we enjoy doing and all the other care that we enjoy doing. That's really where the money is made. And so not necessarily those wellness visits. So it's not a monetary thing. Now, if you go to, one of those, high volume, like one-stop shop, open on a Saturday at a gas station, vaccine clinics, yes, those are, obviously monetary, because that's all they do. And so they do volume, and that's how they make their profit there. But in general, your veterinarian is not having you come in for wellness visits or vaccine visits or recommending vaccines in order to turn a profit, because they probably are actually losing money on that visit. It is more about getting established with you and hopefully building a rapport there. And so I want you to understand what's going on with vaccines, because ideally I want you to make the best decision for you. And so we're going to go through some of the science behind it without getting too in detail with immunology, because I know that is not the audience of this channel. So if you are one of those people that really like to dive deep into the science behind it, this is not going to be at that level. This is going to be more of an introductory, just general broad understanding of the topic of vaccines and how they work. So we do have different types of vaccines that we have in veterinary medicine that we may offer you. The most recognizable one is a rabies vaccine. That is a killed vaccine. That means that the little bitty virus particles that are put in the vaccine for the body to develop a immune system response to are not active. There is no way that your pet can get rabies from a rabies vaccine. It is completely killed. And so why is that? Well, we don't want you or your pet getting rabies because it is 100% fatal. And so the rabies vaccine is a killed vaccine. And that is probably one of the most recognizable ones that you will see. We have what we call a modified live vaccine. So that is where we have taken the virus particle, and it is still a live virus, but we have modified it so it is not virulent. And that's going to be an example of your parvo vaccine. And so that is why if your pet is pregnant, we probably will say it's okay to get the rabies, but it is not okay to get the parvovirus vaccine, because there is a slight chance possibility that a new baby or a new puppy or some animal may have the experience where that immune system, that modified live virus, even though it's modified, still can become virulent in them. Now, I have never seen that happen, but that is what a modified live virus is. It is a live virus, but it has been altered such that it is no longer virulent. And that's kind of the same thing as your Bordetella vaccine, which you will often see that as a virulent live culture. So bacteria, we culture bacteria, and so that's just another nomenclature of we have taken the bacteria and we have made it non-pathologic, we have made it avirulent, and so that is an example of that. But the main take-home thing is that they all do the same thing. They allow the immune system to see a danger and learn from it in a controlled setting. And it's important to know that when we're doing that, it's a marathon. It's not a sprint, okay? We are not just giving a vaccine and saying, poof, you are now, I give it to you today, and now you can go to the dog park and you are set to go. That is not how it works. The immune system takes time, and it takes priming, and it takes learning. And so that is why we have booster series, and why we recommend after vaccines, you wait 2 weeks before doing your boarding, your grooming, your socialization, all those things, because it takes time. It is a marathon. It is not a sprint. Boosters. That's kind of what we're talking about with that terminology, the booster series. What is the booster series? Why do puppies and kittens need booster series? It's because their immune system is naive. It doesn't know what to do. It doesn't know how to respond. It needs training. And so there is a thing called maternal antibodies. When you have a properly vaccinated mom or dad, or a mom or dad whose immune system has already developed the antibodies it needs, the mom will actually pass on those antibodies to the baby. And so it's very important that if you are in a breeding situation, that you have your parentage properly vaccinated, because those vaccines will actually pass to some extent to the babies. And that is why in a lot of states we have health certificates that need to be issued, because we want to make sure that those babies are properly vaccinated. It's nature's way, this maternal antibody situation is nature's way of giving them the best start that it can. So Mother Nature is taking some of mom's antibodies and giving them to babies so that baby has something to deal with while its body is still learning. And that's great, and those are great intentions by Mother Nature. Mother Nature always has great intentions, but we can do better, because those maternal antibodies aren't super strong, and we don't get the best results, and we don't get long-lasting results with maternal antibodies. And so this is probably about the most scientific that we're going to get in this presentation. I made this little chart for you guys. There is a phenomenon called the immunity gap. And so that is where you've got your mom's maternal antibodies over here on the 2-week side. You can see there across the bottom is the age. You got your maternal antibodies there, really, really, really high, and like 100%. They're 100% of what the pet has. That's what they're going off of on their immune system. Over time, that's going to go away. Those maternal antibodies are going to disappear. The body is going to use them up. And then we've got the new puppy, the new kitten's immune system starting to ramp up. As you can see, there's a gap between those, and that's called the immunity gap. That's the time where the maternal antibodies have gotten so low that they're not providing super good protection, and the pet's natural antibodies that they are learning to develop haven't really gotten up to speed yet. And so there's a gap there where your pet is specifically susceptible. And that's where the booster series come into play, and why booster series in puppies and kittens are so important. We are bridging that gap of really vulnerable time in your pet's immune system where their bodies just cannot the bodies cannot withstand or be able to tackle any exposure to any pathogens that they may encounter. And so that's why we have the booster series, and that immunity gap happens between 8 weeks and 16 weeks of age. That's the typical time that we're going to start vaccines. If you start them earlier than like 6 weeks of vaccines, you're going to have maternal interference. So the maternal antibodies are actually going to chew up those vaccines. So I have seen places where they'll start vaccines at 4 weeks or 2 weeks. That's really not useful, and that would be essentially over vaccinated because the maternal antibodies are just going to destroy the vaccine. They're stronger than the vaccine at that point in life. So we don't start vaccines in puppies typically until 8 weeks of age, and then we end at 16 weeks of age because that's the immunity gap, okay? Your vet team will help you stay on schedule with that. It is very specific. It is very time sensitive. It's not made up. This is based on research that we know from vaccine companies that have tested this to immunology that far precedes my veterinary career. I mean, this has been known for a very long time. And so it is something where your veterinary team will work with you. Yes, not every puppy starts at 8, 12, 16. Maybe you found your puppy and we don't know the age. So there's a lot of variations there. So your vet team will keep you on track with making sure that we bridge that immunity gap appropriately. And so we're not having any lapse in coverage. If you start on a vaccine series, a booster series with a puppy, and you miss one, yes, your puppy may be at risk. And so you may have to restart the series. And so each booster series is building on the other. Remember, it's the marathon. It's not a sprint. We are slowly ramping up to where we need to be until all the maternal antibodies are gone and the puppy or kitten's immune system is fully in swing. There is a booster series for adult dogs as well, and so it's not a one and done for a lot of vaccines. We do need to prime, again, the immune system in a very controlled fashion. And so even adults, yes, do need booster series. And again, your veterinary team will help determine what is the most appropriate booster series interval for your particular situation. And so if you are interested in that and how we come about that information, the information is always changing. So it's not something where, this was discovered 100 years ago and we've just stuck to it. No, that is absolutely not the case. There is research always being done. And the American Animal Hospital Association, or AAHA, releases a vaccine task force for cats and dogs all the time. Usually it's about every 5 years they reevaluate and revamp based on the current data and research, and allow veterinarians to read that and kind of reconfigure or revamp vaccine protocols. And so let's talk about some of the core vaccines for dogs. Bordetella. And so Bordetella is actually a bacterial infection. It is a bacterial upper respiratory infection. The name of the bacteria is Bordetella, okay? It has nothing to do with boarding. I know that was just a horrible coincidence there because that does confuse a lot of people. you can impress your vet team if you know that, because it does wear on us sometimes, where people are saying, well, my pet doesn't need Bordetella because they don't board. It has nothing to do with boarding. It is the name of a bacteria of an upper respiratory pathogen. You get it a lot more places than boarding. You will get it simply by walking outside. If there has been another pet that has had that particular bacteria, it is airborne. It is very common nowadays for people to take their pets everywhere. They take them on airplanes. We see them in hardware stores. We see them in restaurants. And so if any of those pets are carrying that bacteria and it gets on your person, you can then bring it to your pet at home. So even if your pet legitimately never leaves the house, they are unfortunately exposed to Bordetella. And if their body is not primed to deal with that, and they're naive to it when they become exposed to it, you can find yourself in pneumonia and having some pretty costly hospital bills, with oxygen cages and things like that to deal with it. The other common one that you'll see is the DHPP. That is the distemper parvo parainfluenza canine hepatitis vaccine. That is a combo vaccine. Note is not too much to put in combo. We're going to talk about that a little bit later. But distemper is an upper respiratory and neurologic disease. Parvovirus is a gastrointestinal disorder. It also affects the immune system and the heart. Parainfluenza, again, is another upper respiratory, and hepatitis is a liver viral disease. Then we have leptospirosis. Leptospirosis is becoming really talked about a lot these days. We are seeing an uptick in the human population of leptospirosis. Used to be where the vaccines for that were not very good, and it was a really sketchy risk versus reward dynamic there. That is not the case anymore. The vaccines are extremely non-reactive now, and so with that, the recommendation now is that leptospirosis is a core vaccine. Leptospirosis is a bacterial vaccine, so it is a bacteria. It is a spirochete that can affect people. It is most transmissible in urine. But that urine can simply stay viable with the bacteria just because it stays moist. So dewy grass, anything that is still moist, that bacteria can stay active. And if it touches your mucous membranes or your pet's mucous membranes, it results in kidney and liver failure. And it's one of those ones that can stay with you for a long time, even if you are properly treated. It can stay in the system. And then, of course, rabies, 100% fatal. Zoonotic, meaning people can get it. And so those are going to be your core dog vaccines. In cats, we have the feline leukemia vaccine. It is a viral-induced leukemia in cats, and that is going to be a risk-based vaccine. And so most kittens will receive it so they get a good immunological base in case they ever get out or their lifestyle changes. But that's going to be a risk-based vaccine. Then we've got the feline viral rhinotracheitis vaccine, also known as the FVRCP. Upper respiratory in cats is very common, just like urinary infections are very common in cats. And so when cats get these upper respiratory infections, they often will stop eating. And if a cat stops eating for more than 5 days, literally as a veterinarian, it's very difficult for us to bring them back. And so when they get these viruses that clog up their sinus pathways, they will stop eating, and then we can very quickly get into a situation where I cannot help you anymore. And so again, that's back to where prevention is key, because I understand for a person, if you get a stuffy nose, you may say, okay, I got a week, I'm going to feel a little bit under the weather. It is what it is. In a cat, if they go more than 5 days without eating, we literally are getting into some serious situations. So yes, it can be a simple upper respiratory infection, can be actually life-threatening. And so prevention with that FVRCP. And then again, rabies. Now, these are core vaccines. There are other vaccines out there that may be risk-based to your specific area. So Lyme vaccine, there's vaccines for all kinds of things. Canine influenza, there is a feline Bordetella, and so your veterinarian may recommend other vaccines depending on your geographical location or your specific risk factors. But these are considered core vaccines by AAHA, and you can check out the AAHA task force for feline and canines. You can just Google that, and you can read the whole spiel. So what are some of the common concerns that I get a lot, and I want to address those because they come up a lot. Vaccines are one size fits all. It that is not exactly the way to think about it. And so we are not talking about a dose-dependent situation like an antibiotic where, you have a smaller size, you need a smaller dose. We're not talking about a specific infection. We're talking about the immune system, and we're talking about it at a cellular level and cellularly, and everybody's made up of the same cells. We're not talking about the number of cells, just the cell in general, a cell in general, the amount of stimulation it needs to stimulate the immune system. And so it's not a dose-dependent situation based on size. It is based on an actual cell, a literal cell. How much does a cell, any cell, all the cells are the same. Just because you're a big dog, it just means you have more cells. It doesn't mean your cells are bigger. What does that cell need to develop an immune response? And so vaccines are not dose dependent. And so you don't need to worry that if you have a small dog or a big dog, the dose is the same. Because it's meant to be. It is because at the cellular level, your Chihuahua is the same as a Great Dane. So that's one of the more common ones that I get. The other thing is a lot of times we'll give a bunch of vaccines at the same time, or like a combo vaccine like the distemper parvo parent influenza combo. That is also something you should not worry about because the vaccines are tested for this purpose. And so when the vaccine companies developed these vaccines, they were made and they were developed to be given all at once. We've got this maternal antibody situation going on. And so we want to make sure that we're doing everything possible to kind of overcome that and get through that. And we don't want to have a gap there where our pet is susceptible and we are drawing out this vaccine schedule beyond that immunological gap. And so a lot of people will ask about splitting vaccines. This was something that was done in the past. We know now that splitting vaccines is not ideal, and it may be ideal for your particular situation. So again, talk to your veterinarian. But in general, splitting vaccines or saying like, well, this week I will do the rabies and then come back, and then we'll do distemper and then come back, and we'll do the lepto and then come back, and we'll do this, that, and the other, okay? What that is doing, it is resulting in more visits, and you are delaying it so that you're missing that window. It also delays your protection. So now where your pet would have been, done with the vac series in 2-3 months, now we're extending it to 6 months, however long, that you guys have done it. It's going to be more costly again. You've got more visits, more stress. You're exposing your pet to more travel. They can't now go out and do the things they would have done, like puppy training and things like that, because we have extended unnecessarily the vaccine intervals because they are tested and meant to be given at the same time. The other thing is, like we talked about maternal antibodies, chewing through the vaccines and destroying them. If you give a vaccine, let's say, today, and then you can't just wait 2 days and give the other vaccine, because the first vaccine will actually chew up the second vaccine. So you end up having to wait this 2-week interval, and then now we have very much delayed proper immunity on the pet for no specific reason. Vaccine reactions are the other concern, and we'll get to that in a minute with a little bit more data and statistics. But vaccine reactions with current vaccines, if you're going to a vet and they are giving a high quality vaccine reactions are extraordinarily rare. And we're going to get to the exact numbers and what to look for vaccine reactions in a little bit. But, that is a common concern, and we do hear you when that is a concern, and absolutely voice that concern, because there are things we can do to help assuage those concerns. And the other thing is vaccines are poison. We're putting poison in our body. I know that has become an even bigger controversy, after the pandemic and things like that. It's always a risk versus reward, okay? There's nothing in life that is not a risk versus reward. And so it is important to have that discussion with your veterinarian on what vaccines are appropriate and the reasons why they are appropriate. Because yes, there is that small chance it is a foreign material going in your pet. There is that small chance that you could have an issue there. So we want to make sure that we're giving the vaccines for the right reason. And what's your definition of a poison? So antibiotics are poison, right? And we put an implant or we do a liver transplant. The body thinks that it is poison. Chemotherapy is a poison. And so be careful with that general term and that negative term of poison, because sometimes those things can actually do good if used properly. And so what about adult dogs and cats? Why do they need vaccines? That's a good question, and it's definitely a good question to ask your veterinarian. The reason why is because of exposure. Is your pet really being exposed a lot? Is that immune system really having to work hard to do that? Immunity doesn't last forever. And so, yes, theoretically, these vaccines are tested, and we know they last a year, maybe they last 3 years, depending on the data has been done and researched. But there's no guarantee on that. And so, again, do you want to risk your pet getting parvovirus and having to pay thousands of dollars, or do you want to just kind of have an insurance plan and have the vaccine? As animals get older, the immune system does the opposite of the maternal antibodies. Now the immune system is going down. And so, when does the immunity dip below the actual level? When do we need to boost that up again? And in general, you're going to follow the manufacturer's guidelines on, when they know their vaccine is going to start to wax and wane. We talked about the AAHA Vaccine Task Force, and I am going to put that link in the description box. Much more detailed information on that and adult booster schedules that you guys can check out. I'm not going to spend a whole lot of time there, but the takeaway points are here. It's always based on risk and reward, and you don't always have to do the vaccine. There are instances where titers may be the best option for you. So if you think your pet is too old, or your pet has an immune condition where they can no longer get vaccines, or your pet is on chemotherapy or something like that, don't just tap out. Talk to your veterinarian about some alternatives that may be there, because I have definitely seen cases where a pet has come down, let's say with leptospirosis, and I'm like, what happened? Why did we fall off the bandwagon here? Oh, well, I thought my pet was too old, so I just stopped doing it. Don't do that. Don't tap out. Don't just stop. There are options there that we can still make sure that your pet is protected and do the right thing. So discuss that with your veterinarian. Don't just shut off. The immune system does change, and so we need to be making those adjustments with you, and we want to do that. That's why we're there and want you guys to come in for those yearly exams. There are also some legal requirements due to public health. We talked about that, and the big one is rabies. It is 100% fatal in people. Okay, we don't want you to die. We don't want your neighbor to die. We don't want anybody to die. And so there is a significant public health concern with some of these vaccines, and so that is another reason why. I wanted to go a little bit over on vaccine reactions, because I know that's a really big one. These are the statistics. You can check the description box for the full article. It was published in 2005 in JAVMA under more, so you can Google that, and I will put it in the description box. But there are about 13 reactions for every 100,000, for every 10,000 vaccines administered. I believe they took the vaccine reaction rate from the Banfield hospitals. They have a huge database, and so that's how they came up with that number. So that is 0.13% vaccine reaction rate. And so I know that there are definitely people out there that think that number is a lot bigger, or they have been told by a breeder or a groomer or whoever somewhere on the internet, celebrity, has led you to think that the vaccine reaction rates are much higher. But no, they're not. Statistically, they are less than 1%. They are less than 0.5%. And so do keep that in mind. Now that you know that information, that may change your calculus a little bit. And it's also important to remember that when they're that 0.13%, when they're reporting that is all reactions. And so that is not just your pet has died reaction. That is running the spectrum of reactions. So that could be your pet was sore and they reported that as a reaction. That could be mild itching. That could be hives. That could be a mild fever. And so it doesn't mean that 0.13% aren't even pets that are dying or going through anaphylaxis. That is all vaccine reactions. The severe ones are even less, almost negligible. And so yes, I understand if it happens to you, it's 100%, but please know it is very rare. And if your pet does develop a mild reaction like soreness, itching, hives, facial swelling, very easily treatable. We can simply just give a antihistamine or a steroid injection, and everything is going to be fine. Let's go through now with that some rapid fire questions. Things that I hear a lot, and things that I am constantly having to reiterate, and so I don't mind doing it, but we're going to do it here so that we can reach a larger audience. So can you half the dose? No, you cannot. So that is a common thing. Not so much anymore, but when I first started practicing 15 years ago, it was, I had, my old vet, they used to just give half the vaccine. Can you do that? Absolutely not. The vaccines, again, go back to what we discussed about. It has to deal with the cellular, at the cellular level, the stimulation that is needed. Half the dose of the vaccine is not going to get there. So do not waste your time and money. No, you cannot half the dose. Can you concentrate the dose so the volume is less? Okay, so normally vaccines are 1 ml vaccines. It is not a huge volume. Yes, if you have a little tiny dog, you may see that little bleb. But when your veterinarian suggests, or you read somewhere on the internet that you can just put half the, you can just dilute it, because a lot of these are 2-step. You've got a freeze-dried, a freeze-dried portion, and then you dilute it to activate it. Can you just put half the dilute in it, make it more concentrated, and only give half it, only have to give half an ml? No, you can't, because now you have altered the pH and you have altered the reconstitution, and so you are putting your pet more at risk by not doing it correctly and maybe causing more pain because you're not having the correct dilution there. So no, you cannot concentrate the dose so the volume is less. Can you split the vaccines? We touched on that as well. You can do that, but I don't know why you would do that. So by splitting the vaccines up and only giving distemper today and then waiting 2 weeks, and because you have to give that distemper every 4 to 6 weeks-ish until 16 weeks of age. Now you've induced that interval over 3 and you're coming in. It's very confusing. I don't know why anybody would want to do that. There's no need to do that. You are essentially taking a 3-month protocol and making it, depending on how many vaccines you're giving, 6, 12 months unnecessarily. And in that time period, your pet is left unprotected for a number of things because there's really no reason. Back in the day, that was something that was done, but that is old school. That is old medicine. Let's not live in the past. Let's live in the current and live in the future. We know better now, so let's not do that. Can you just get them at the feed store or the farm store? Yes, you can, but I wouldn't do that. And I am going to speak from personal experience here, and I know a lot of other veterinarians have had this happen more than we care for. The quality of the vaccine and how the vaccine is handled. So the chain of handling is very important. Okay, we are dealing with a biological. Now you guys know that we're dealing with a biological, we're dealing with a living thing. If it is not cared for and stored properly and administered properly, you are asking for trouble. I cannot tell you the number of times that I have seen a puppy come in and we're talking to the owner and it looks like it's parvovirus. I mean, we all know that smell. It looks like it's parvovirus. Says, oh, is your puppy vaccinated? Yes, they are. And, veterinary mind is thinking, I don't know, the vaccine is 99.9% effective, but this really looks like parvo. I'm going to go ahead and test, and the test comes back positive. And I'm like, oh my gosh, do we have a bad batch going on here? Where did you get that vaccine at? And then it comes out that the vaccine was purchased from a feed store. It only takes that refrigerator door at the feed store to be left open a couple times for those vaccines to be ineffective. It only takes those vaccines sitting on the truck before they get unloaded to those vaccines are no longer effective. Sitting in a box waiting for the employee to put them away, you can insert any number of issues there of a medical grade something not being treated like a medical grade something for those vaccines to be inaccurate. When we get vaccines at the veterinary clinic, we buy them from a very reputable source, directly from the manufacturer, in fact. Those vaccines come off the truck. They come in a cooler. That cooler has an ice pack. They are inspected that the ice pack is still frozen. I know when it was shipped. Literally, I order them, and then I know they're coming tomorrow, and so I make sure that happens. If they do not show up tomorrow, I'm calling the company saying when those vaccines show up, maybe tomorrow or the next day, I don't want them. They're not good anymore. So I'm doing that. I'm not a store manager who's got a million other things on their mind. I'm doing that. That quality control is extremely important. And so I cannot tell you the number of times, going back to that scenario where I'm like, oh my gosh, what is going on? The parvo test is positive, and we find out that those vaccines were given by the owner or the breeder or whoever from the feed store. Yes, I understand we're trying to save money, but this is not the place to be saving, because this can be a very costly, financially and costly, life costly thing. So can you buy them at the feed store? You can, but I wouldn't, and a lot of veterinarians will not, and boarding facilities will not recognize vaccines that were not administered from a veterinary clinic for that reason. It's not because we want your money, it is because we know, and we have seen time after time after time, the vaccines rendered ineffective because of the chain of handling situation that occurs. Little story here, we'll take a pause. I worked in a clinic where we had a breeding facility that we worked with, and all of a sudden, and they were very good, they're a good breeding facility, and all of a sudden a bunch of the puppies started coming down with parvo. And so of course we're trying to troubleshoot the situation. You know, what have you done different? Have you bought it in a different place? And finally we get down to where are you storing them? And they're storing them in a refrigerator, and we're like, okay, well, what else is in the refrigerator? And it came to be known that they were making their pets food. They were making their own diet. We're not going to talk about that here, but they were making their own diet. They were cooking it. They were putting it in the refrigerator to keep it fresh, in the same refrigerator as the vaccines. The hot food was altering the temperature of the refrigerator, where it was dipping below the recommended temperature, and it was inactivating the vaccines. That's why other dogs were now getting parvovirus. And so at my clinic, I am so scarred by that, that I have monitors on all my refrigerators that if that temperature dips below what is supposed to dip, the most obnoxious alarm goes off in the clinic. We have to physically go over there and turn it off and check it. I have actual thermometers in all the refrigerators. That alarm goes to Bluetooth to the office manager and my husband, who's the CEO of my company. I used to have it on my phone, but I was just too paranoid about it. So for my own mental health, I don't do it anymore. But we log all of that because that is how important it is that those vaccines are temperature controlled. And so, long story short, can you get them at the feed store? Yes, but I wouldn't for all those reasons. Can you just do titers? Absolutely, you should, and I recommend that you do titers if that is your preference. There are some good companies out there. Statistically, there are some that are bad. There are some that are good. I believe VaxiCheck is a really good one. They did some JAMA articles recently on there where they did a good job, and everything, the numbers made sense. But you do need to know about the limitations about titers. So if you choose to do a titer and you think that is good and that's good for your particular situation, please know that there are certain boarding facilities or travel restrictions on titers. And the reason being is when you give a vaccine and it's a licensed 3-year vaccine or 1-year vaccine, the company knows based on their data and research that vaccine is going to last that long. It probably lasts a little bit longer, but they know for certain that it is going to last that long, barring some unforeseen circumstances. When you do titers, it only means that your pet is good the day the titer is taken. So you can take that titer today, and realistically tomorrow your pet can drop below titer levels. And so there are some limitations with that. So even though you get a titer today, it does not guarantee that your pet's going to be good for the whole year. It only means that your pet is good for that moment. Whereas the vaccine, if you give it, they are somewhat certifying that it's going to be, the length of the vaccine that has been purchased. So if it's a 1 year, a 3-year, 3-year. Can we rotate vaccines? Yes, we can, and that's what's recommended. If you read that AAHA task force, there are some vaccines that we do every 3 years. There are some vaccines we do every 1 year. I do hear somewhere out there where, isn't that the 10-year rabies? There is no 10-year and there's no 5-year. There's no manufacturer that has a 5 or 10-year. But yeah, we rotate certain vaccines every 3 years. The rabies can be every 3 years. The distemper can be every 3 years. The parvo can be every 3 years. And so, yeah, there are appropriate rotational schedules, and you should be talking to your veterinarian about them. And if you want to learn more about that, you can read the AAHA task force. My pet never goes outside. Do they really need them? That is something to discuss with your vet team. In general, the answer is going to be yes. There's so much free movement of pets now, everywhere. They go everywhere. They go on planes. They go, to the parks. They go everywhere. And so even if your pet never goes outside, you go outside. And so you are bringing things back home. And so yes, it's a risk versus reward. It may not be appropriate for every single pet, but in general, with the safety margin, that 0.13% vaccine reaction rate, yes, it may be appropriate for even pets that never go outside. And then you also have to factor in, can you afford treatment? So if you're not vaccinating your pet, do you have that slush fund where if your pet does get distemper and needs to be on a ventilator, can you do that? Can you afford that? Is there anything I can do to prevent a reaction? I am scared. Absolutely yes. Do not let your fear of a vaccine reaction deter you from giving your pet the proper care, especially if you want to do that. So talk about it with your veterinarian. It could be something where titers are more appropriate. It could be something where we just offer you a pre-med. You give a Benadryl or something before the appropriate dose, get the appropriate dose, but you give that before you come in the clinic. It may be something where we just give it in a shot. We can give it a shot while your pet's in the office and we do our exam, and it's sit there for about 10 minutes and then you get the vaccine. So there are absolutely things that you can do to prevent a reaction. We can recommend warm compresses. We can send home an anti-inflammatory. All kinds of options out there that we can explore, but you just have to bring up that conversation. Do not just say, I'm not going to do it because I'm scared and I don't want to talk about it. Talk about it. And so ultimately the decision is it is yours. Ultimately the decision is yours. We can't make you do anything. So I want you just to take this information. I want you to make an informed decision. I want you to talk about it with your healthcare team. And I hope that this has dispelled some of the common myths and has brought some food for thought. So if you like this video, please like and subscribe, and I will see you guys next time.